My name is Dr. Janet Harris Hicks. I'm a board-certified urogynecologist and I practice in Myrtle Beach, South Carolina. My family is originally from southeast North Carolina, both Robeson and Scotland County. My father served in the military, so we moved around a lot as military family. My higher education began at the University of North Carolina in Pembroke. I completed 3 years of training there, with my last year in undergrad completed at Duke. I was very blessed with a scholarship from NASA for minorities in science, engineering, and mathematics. That scholarship afforded me opportunity for clinical research, which allowed me to complete that training at Duke. Following Duke, I went to UNC Chapel Hill for medical school. My internship training in general obstetrics and gynecology was completed at the University of Texas in Houston. I then traveled to Greenville, South Carolina, where I completed my training in OBGYN, as well as specialty training in female pelvic medicine and reconstructive surgery. My third great-grandmother was a medicine woman within our tribe. I'm a member of the Lumbee tribe in North Carolina. Her influence over the years focused my specialty and interest in women's health. This is why I chose to focus on the care of women. The number of women who suffer with pelvic floor disorders in the United States and yet have no idea that there are options for treatment outside of decreasing their activity or wearing pads or pull-ups is an atrocity. So I have made it my mission to get education to women about when and where they can seek help, and that these issues can be treated and they no longer have to wear pads or pull-ups. They no longer have to limit their physical activity. My areas of interest and service to women focus around pelvic floor disorders. There are 3 broad groups of pelvic floor disorders: urinary incontinence, fecal incontinence, and pelvic organ prolapse. Within urinary incontinence, women can leak urine with activity, or they can leak urine with a sudden urgency to rush to the restroom. In regards to prolapse, this oftentimes results in heaviness and pelvic pressure. Obviously, with fecal incontinence, this is a loss of stool before you are able to get to the restroom. We have wonderful treatment options for these issues of pelvic floor disorders, and 1 in 4 women in the United States suffer with a pelvic floor disorder if they are above the age of 18. The incidence of pelvic floor disorders drastically increases as a patient gets older. Again, it is very important that women are educated on their options of treatment and realize that they do not have to decrease activity or simply wear a pad or a pull-up. In regards to pelvic pain and interstitial cystitis, we also focus on these issues of treatment for women in pelvic problems. I want my patients to know that when they come to Southern Shores Urogynecology and they seek care with myself as well as my care team, that we are following evidence-based medicine, that they are coming to a practice where their treatment plan will be individualized to their independent goals in life and improvement in their quality of life, that we have sustainable treatment options to improve the quality of life and allow you to return to an active lifestyle of your choice. I want my patients to know that you may have seen many providers before coming to our office. Those providers may have told you there was nothing that you could do to improve your quality of life, that you simply had to live with it, that you had to put on a pad, or you have to decrease your activity. That is simply not true. It is not a normal part of aging to leak urine with activity or not be able to reach the restroom. And we provide scientific, evidence-based pathways where we follow these care pathways to allow the patient to choose their individualized treatment plan, improve their quality of life. We utilize shared decision-making to listen to our patients and understand their goals and then assist them in meeting those goals.